Good morning, guys. Tony Maritato here, licensed physical therapist, and in today's video I'm going to show one of my patients. I'm sharing it with everybody, but this is actually designed for a single patient, what exercises to do with a red rubber band. Now, these come in different colors. Typically, the darker the color, the more resistance, but there's other ways to vary the resistance. I do. When I give a patient one of these rubber bands, I always go with red just because it's the medium resistance and it's so adaptable to so many things. So if you're thinking about buying one for yourself, I'll put a link down in the description where you can buy just a single length, and red just tends to work the best. But this is specifically a program. One of my patients had a knee replacement on the right. They're trying to prepare the left so that when they do have a knee replacement on the left, the whole leg is really in better health to recover from the knee replacement more quickly. So my ideal pre-surgery program is strengthening the hip, strengthening the ankle, improving the stability and balance without flaring up the knee. So I'm going to do 3 rubber band exercises in this video, and then in the next video I'll do some ankle strategy exercises. You can see that when I link to it. But basically all I do is I have a single length. It's a little longer than arm's length, probably from the center of my body out to my fingertips. The way I like to do it is at the kitchen counter. I'll lay it down. I'll put the leg that's being exercised inside and fold it over. My other leg is gonna stand, and that's my anchor. And so the 3 directions that I look for to improve the hip to prepare for a knee replacement is a simple, what we call abduction, abduction. I'm pulling the rubber band tight out to the side. It doesn't really matter too much how high I go. The reality is, if I'm doing this after a knee replacement, I'm building stability on my right standing leg while I'm building strength through my left moving leg. So it's benefiting both sides. But typically on a prehab program like this, I might do 15 or 20 of these. These are really just designed to improve the tissue quality and get some circulation. It should not produce any pain through the knee. Once I've done 15 to 20 out to the side, what I'll do is I'll do about 15 to 20 kick outs behind me. Now, if you notice, it's an arcing motion. I go out and back. I'm not just going straight back. I'm also pointing the toe just a little bit so that the band doesn't slip off. So if it does slip off, no big deal, you just reset. I put it down, I step over it, I come on. So I've got 15 to 20 abduction. I've got 15 to 20 hip extensions. And then the last one is gonna be a movement in front of the body. So either I'm gonna pull the knee up toward my waist, my ankle is flexed, my knee is flexed, or I'm gonna pull it across to the other side. And so while I would normally do this exercise facing the counter so I can lean on something really stable, to demonstrate and so you guys can see the exercise, I'm gonna do it facing the camera. What I'm doing is I'm bringing my outside heel just above my knee on the other side. It's a hip flexion and rotation. The hip, like the shoulder, has a lot of mobility. It can move in a lot of different directions. It's a ball and socket joint, which gives us lots of mobility, but it's inherently a little less stable. Now, the hip is way more stable than the shoulder, but the reality is I need to build stability to control my movement. So many patients tell me that when they're walking, they don't feel stable. They're not sure that they can kind of control their body in space. And part of that is coming from the hip, parts coming from the knee, parts coming from the ankle. But you can imagine so many patients have low back issues. When I'm walking, I spend about 60% of my time on one leg because the other leg is swinging through the air. So those of you that want to get back to a normal walking pattern, building that hip stability again with these 3 exercises, once they've been prescribed by your physical therapist, will help improve the quality of your ability to walk. Because if I can create a stable hip, I can create a stable pelvis. It allows my other leg to swing through without dropping. Also, from a low back perspective, if I have a lot of this side to side motion when I'm walking, my low back has to compensate to keep my eyes on plane and to keep me level. So if I want to protect, reduce some of the lateral motion through the lumbar spine, I build strength through the hips to level out the pelvis. This motion now disappears as I'm walking. Lots of stuff. I know I went on a tangent. Guys, basically bottom line, my favorite 3 here. One more time, I put the foot in, fold the band over. I've got my kickouts to the side. I've got my circles back. I've got my lifts in front, or a lift with a twist. Those are my hip pre-op programming. Only do it if you've been prescribed by a licensed physical therapist. I gotta get back to my patients. Thank you guys so much for watching. Please subscribe to the channel and I'll see you on the next video.